Hello everyone and welcome to the video series on Toronto Notes for QE1 candidates. I'm creating these videos to help QE1 candidates review Toronto Notes page by page. And I want to make this memorable, easy to assimilate for you. So I've included a clinical case, text from Toronto Notes, and common examples. We also have a practice question in there. I'm hoping you enjoy this. Please like the video, add the playlist to your library, and subscribe to the YouTube channel. Today's video is on lung cancer screening. As a reminder, we're going to cover the family medicine section of Toronto Notes in this playlist, and it includes topics on periodic health exam, health promotion, and palliative care. All other disease-specific topics in the family medicine section of Toronto Notes will be covered in the specific specialty so that I don't duplicate efforts. All right, let's get into it. So, as I said before, the focus today is on lung cancer screening. It's on page FM4 of Toronto Notes 2024. The key exam challenge here is identifying which patients qualify for screening and which patients do not. So many of the question stems that you will see on the exam will have different distractors like family history, occupational exposure, chest x-ray screening. By the end of this video, you will know exactly who should receive low-dose CT screening and who should not. You'll be able to screen out unimportant information in the question stem. All right, let's start with this clinical case. Mr. Smith is a 62-year-old man who has smoked one pack per day for 35 years. He doesn't have any symptoms. During his annual visit, he's asking you, as his family physician, should I be screened for lung cancer? Before you answer, think about the factors that matter. Does his age matter in this decision? Does the smoking history matter? Does the fact that he has no symptoms also matter here? And what tests should you use for screening? So keep those questions in mind as we review the guideline. According to the Canadian Task Force recommendations, lung cancer screening is recommended only for a very specific high-risk group. 3 criteria must be present. First, the patient must be between the age 55 to 74 years. Second, they must have at least a 30-pack year smoking history. Remember that you calculate pack years as number of packs smoked per day multiplied by number of years they've smoked for. So if they've had 1 pack per day for 30 years, that's 30 pack years. If they've had 2 packs per day for 15 years, that's 30 pack years too. Third, the patient must either still smoke or have quit in the last 15 years. If they meet all 3 of these criteria, then they should undergo the annual screening using low-dose CT, often abbreviated as LDCT. Let's talk about the QE1 pills that you should remember. Patients should not be screened if they do not have all 3 criteria. For example, if you have a 50-year-old smoker with 40 pack years, does not meet the age criteria. A 70-year-old who smoked 20 pack years does not meet the number of pack years criteria. A 65-year-old who quit smoking 20 years ago does not meet the current smoking or quit within 15 years. So they must meet all 3 criteria. Another common exam trap is the screening modality. They may put in the options, should you do a chest x-ray? Should you do a sputum cytology? The correct screening test is low-dose CT. Chest x-ray should not be used for lung cancer screening. Adding sputum cytology does not improve its usefulness as a screening strategy. If the question asks for the best screening test in an eligible patient, the answer is low-dose CT, not chest x-ray. Now let's run through this practice question together. Pause the video and choose your best answer. So C is the correct answer. The patient is 68 years old, so she's in the eligible age range. She has a 40 pack year smoking history and she quit only 10 years ago. So she's still within the 15-year cutoff and she qualifies for the annual low-dose CT screening. So the correct answer is C. Let's finish with this key takeaway. For QE1, think of 3 things. Is the patient age between the age of 55 to 74 years? Does the patient have at least 30 pack years of smoking Is she currently smoking or smoked within the last 15 years? If all three criteria are present, then the LDCT is recommended. If any of the criteria is missing, no screening test. Remember, chest x-ray should not be used for lung cancer screening. Thanks for watching this video. Remember to like the video, subscribe if you've not already done so, and I'll see you in the next one.